You know, this is not a story that is unique to Josh Stein. In fact, someone in the U.S. has a stroke every 40 seconds.
Yeah, we've been talking about politicians just in the last 2 weeks. Senator Chris Van Hollen from Maryland, the senatorial candidate now, the lieutenant governor in Pennsylvania, John Fetterman. Stroke Awareness Month coming to an end, so our 9 Health expert, Dr. Payal Kohli, is here to tell us more about it. Well, let's first define what a stroke is.
A stroke is 2 different types of strokes. So one is a blockage in a blood vessel that leads to lack of blood flow to the brain, and the other type is called hemorrhagic, where you have bleeding in the brain that also leads to damage. So anything that can cause damage to the cells in the brain that prevent them from functioning.
And the risk factors, I mean, I'm telling you, every time you go to the doctor, they ask you to fill out all those forms and talk about stroke and blood pressure. What are your risk factors?
You know, the risk factors are the same as they are for heart disease. And the good news here is that the American Heart Association says 80% of strokes are preventable with lifestyle changes. So we really need to talk about what makes you at risk. High blood pressure, high cholesterol, diabetes, smoking. Those are all things that are within our control.
Right there.
That we can modify. Now, some things like age, family history, you know, those types of factors we can't really modify as much. Women are slightly higher risk as well. But the ones we can modify, we really need to get on board, recognize, and start to change.
They do seem generally, when people talk about having a stroke, they come out of nowhere, at least that's how they're described. So what if one does come out of nowhere? How can you help someone who's having a stroke?
They can come out of nowhere and can be very sudden and unexpected. And so the first thing I think is to recognize the symptoms. And that's where we talk about FAST, F-A-S-T. So F stands for facial droop. So if you see a facial droop or any asymmetry of the eyes, of the cheeks, sometimes you can ask them to smile or stick out their tongue. That's a concerning sign. A stands for arm weakness or numbness. And sometimes you actually have them raise their arms up to their shoulder level and see if one is drooping more than the other. But it can also happen in the legs, and you can also just have a tingling sensation depending again on where the stroke is. S is slurred speech or nonsensical speech, or they're not understanding what you're saying. And then T is time to call 911. You got to act right away.
Yeah, get to T, that's for sure.
I know. So like when you hear about this, sometimes we often hear about, well, somebody had a minor stroke or might have had a stroke and they didn't know about that. I mean, and then how do you even know that you did have one of those?
Yeah, so the severity of the stroke depends on the size of the blood vessel that gets blocked or starts bleeding and the location. So if it's a teeny tiny little blood vessel off to the side somewhere, you may not even realize, and it may just be something simple like, I'm more forgetful lately. And sometimes we find them when we scan somebody's head for something else, an MRI, we see that they might have had a stroke a while ago. But if it's a big blood vessel that gets blocked that affects your motor function, that's when you have the weakness on one side, or your sensory function, that's when you can't feel things on one side.
And that changes recovery depending on what type of stroke you have, how severe it is. So what is recovery like for people?
You know, recovery, thankfully, after stroke can be really optimistic. Now, of course, if the stroke is really big to begin with, that can be a little bit worse prognosis. But the most important factor in recovery, getting that blood vessel opened as early as possible. So, you know, if you have a big stroke and you get that blood vessel opened, you get them to the hospital, we call it a code stroke. When somebody comes in and they could have a stroke, because we mobilize those resources really quickly, they could actually have almost nearly full functional recovery. Now, God forbid, their stroke completes, you can't open that blood vessel or it happened a while ago. The brain is an amazing organ. It regenerates, it's plastic, and it learns kind of how to get your function back.
Okay, so when you talk about time, I mean, really, it is minutes.
It is minutes. You got to call 911 right away. And if you're not sure and it's a false alarm, that's okay. But that's a lot better than saying, oh, I'm not sure. Is this person having a stroke? They're acting a little strange. They could be complaining of a headache. They could be confused. Just have a low threshold to seek medical attention.
All right, Dr. Payal Kohli, thanks for helping us out, and hopefully we'll help out a lot of people if they do, in fact, run into this somewhere along the way. Thanks again.